Interventions with a King. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
I'm Habib Samadi from Emory University. I'm one of the associate editors of JACC Cardiovascular Interventions. I'm here with Dr. Ruchira Glazer, who is from Christiana Medical Center in Delaware. And she will be publishing a very interesting paper in the December issue of JACC Cardiovascular Interventions. So Ruchira, tell me a little bit about what your hypothesis was and what you were studying.
Well, we examined patients who underwent primary percutaneous coronary intervention for ST elevation myocardial infarction. And our hypothesis was that patients who underwent intervention during off hours, in the middle of the night, for example, had poorer outcomes than those undergoing intervention during routine hours. We also asked the question of what the factors were that was associated with this. Is this primarily biology, or is this a systems issue, or a combination? And then finally, we wanted to examine the effects of time. For instance, has this changed in the last several years in any way?
Well, all very important and timely issues in our field. How did you go about answering these important questions?
Well, to do this, we looked at the NHLBI's dynamic registry. And the dynamic is a very rich registry because it recruits waves of all patients undergoing percutaneous intervention at multiple centers throughout the country over the course of years. And we looked at, obviously, those patients amongst the registry who underwent primary percutaneous coronary intervention.
What size of a population were you studying?
Well, the registry itself is several thousand patients, and then the primary angioplasty patients represents a smaller percentage of those. So a couple of thousand patients, approximately, is what we looked at. And we looked at them over a wide number of years, 1989 to 2005.
Okay, so what did you find?
Interestingly, we found that in this cohort, patients who underwent angioplasty during off hours, which we defined as 7 p.m. to 7 a.m., so overnight, had poorer outcomes compared with those who underwent angioplasty for ST elevation MI during routine hours. And that held true even if you adjust for the different variables and confounders that could affect that. And we also found that when looking at whether it was really a systems issue or a biologic issue, there's really a combination of the two. For biology, factors such as presentation with cardiogenic shock, multivessel disease, and a completely occluded vessel at the time of angioplasty were important in terms of how patients did.
So let me understand this. You're saying that patients that are biologically sicker tend to present at off hours?
They do, yes. And it's not clear why that is, whether we're recognizing that they're presenting with infarction when they're sicker or whether they're sleeping, and that allows for them to present later in their course and sicker.
Did you look at symptom to balloon times?
We did. Interestingly, there was a small difference between the two, but it wasn't statistically significant. And we tried to get at this another way by looking at weekends versus weekdays, and we found that a weekend when an activation of a cath lab and door to balloon times may be different, didn't affect things as much as you might think. So it really still held that the nighttime had some different characteristic about it compared to the day.
Very interesting. So what are the take-home points?
So I think there are basically three take-home points. One is that at least in this registry, patients who present during off hours seem to have poorer outcomes than those who present during routine hours when undergoing primary angioplasty. Second is that there really is a combination of factors, both systems and biology, that are important. Procedural things such as dissection and use of adjunctive devices is lower during off hours, but patients are also sicker. They present more often in cardiogenic shock, and with multivessel disease during off hours. And then finally, that these things that all patients have, we've been doing better over time. All patients are doing better as we approach 2005 in the registry, but that the differences unfortunately still held true. The outcomes were still better during routine hours, even in the later waves of the registry.
Well, very interesting. Thank you very much for coming, Dr. Glaser, and sharing this with us. This is a very important topic, and we look forward to more of your work in this field. Thank you.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.